Hi, I'm Alicia,
And I'm Josie.
and we are doing our health data analysis on Guatemala, specifically with acute respiratory infections, specifically pneumonia, as it is the fourth leading cause of death in Guatemala for all ages. And so, going off of that, just a little bit of background, it is the leading cause of death in children, specifically RSV, which is respiratory syncytial virus. This affects children under the ages of 2. And then, of course, there's a high mortality for adults, but more specifically, endpoint pneumonia, which is it's very similar to bacterial pneumonia, but it's more fatal and there's more hospitalizations associated with it. And so, some risks that go into acute respiratory infections is air pollution from solid fuels was the top 10 major risk factor. And this is mainly exposed from the burning of solid fuels for cooking and even heating their houses. And so this exposure to the biomass smoke increases the risk of serious acute lower respiratory infections such as pneumonia. And so there's a need for better ventilation, but this is the highest risk factor that we saw associated with pneumonia, RSV for children, and just overall acute respiratory infections. But as well, there's also things like occupational risks and other things associated with higher fatality or things in hospitalizations were things like malnutrition, the lack of breastfeeding, certain medical conditions, lower socioeconomic statuses, and the male sex, which we will go into a little bit later as well. And then overall, it has been increasing in the number of years of life lost and disability adjusted life years. So in 1990, it was number 2 as the leading cause of these numbers. But in 2010, it increased all the way up to number 1. So we see that acute respiratory infections is an ongoing issue for the people of Guatemala and a serious health issue for them. So as for current state, they're seeing a lot of fevers associated with infections, even hypothermia, and of course, abnormal white blood cell counts. But specifically for signs and symptoms, for adults, they're seeing tachypnea, cough, sputum production, blood when they cough, pleuritic chest pain, difficulty breathing, shortness of breath, and sore throat. But as for children, it's a little bit different. They see chest indrawing, retractions, nasal flaring, noisy breathing, and specifically, they see poor nutrition all around from them not wanting to eat, not wanting to drink, or breastfeed. And so, this is a huge issue as we know that nutrition has an important factor in getting better and staying healthy. And so, this is leading to higher risks of death and hospitalizations for especially children. And overall, we saw that there is still currently higher burdens of morbidity and mortality rates in the lower and middle income areas. And so there's just hard to get the nutrition, hard to have good ventilation. And so they're seeing higher rates of acute respiratory infections, but sadly, higher rates of the mortality rate and hospitalizations. And currently, right now, there are some research projects going on and the use of a surveillance system in 3 different places in Guatemala. And this is called VICO. And this is where they actually found the endpoint pneumonia, which was the most common fatal acute respiratory infection actually that they found. And so this is how they found it. And it's just a facility-based integrated surveillance system that they're not only using for respiratory infections, they're using it for diarrhea infections, febrile, and neurologic illnesses. And so there's 3 established starting in 2007. And so this is a great step forward for the people of Guatemala and understanding these respiratory infections better, what comes along with it, how to get better from it, and understand how hopefully they can move forward in the right direction of decreasing this as the leading cause of death in Guatemala.
Like Alicia had mentioned previously, there are so many different risk factors that play a major role in the acute respiratory infections in Guatemala. Malnutrition is obviously a really big one. Just by being malnutritioned, they have a higher risk of having a poor immune system, which in general just makes them more susceptible to infections. We can modify our malnutrition risk factor with the improvement of targeting programs and improving their overall education about nutrition and improving diets with supplements like vitamin A and zinc. And then, as far as like for children, breastfeeding is a major role in protecting against death caused by acute respiratory infections, especially in children under 2. And so, by the promotion of exclusively breastfeeding, we would hope to obviously reduce the burden and morbidity and mortality among young children with acute respiratory infections. So, also through community based providers, like Alicia had talked about the poverty, and there's also a difficulty actually even receiving diagnostic testing in Guatemala. And that is because they have a lack of funds to buy the equipment and machines, or even the health staff to assess for these pathogens. But there is also a lack of just the ability to even receive that care or those diagnostic procedures in general. And just by being able to identify some of those pathogens or like health factors that can cause the acute respiratory infections, we could also reduce the mortality and morbidity. And then lastly, we can also prevent the acute respiratory infections by preventing and managing major chronic diseases. So, for example, diabetes, kidney disease, and influenza, they are all major comorbidities that are associated with acute respiratory infection fatalities. So, the pneumococcal vaccine, for example, or the influenza vaccine can also play a major role, and that could also be provided through community based providers as well to hopefully help decrease the cost and need for those healthcare providers. So, as far as our lessons learned and goals, um, there are many different risk factors that we have that can make receiving healthcare in Guatemala very difficult. So, in Guatemala, the poverty, nutrition, and lack of education play a major role in these acute respiratory infections. Another lesson that we learned that is different from how we receive healthcare in the United States is that each family as a whole, or even different family members, they can all have different like beliefs and perceive illness as different, and they can think that what treatment is available or best for someone isn't best for another. So that's another thing that can make it really hard for our clients to receive care, because they're trying to figure out what they need for themselves, but they also have the input from those around them. So, through the interventions that we had talked about previously, and through using different community resources and evidence based practice, our overall goal would be to decrease the rate of acute respiratory infections, fatalities, and just overall improve the health and quality of life of those in Guatemala.
So as Josie said, for future directions, we want to see those decreased rates of acute respiratory infections, the decreased rates of morbidity, mortality, hospitalizations, and but specifically we want to see it with the pneumococcal conjugate vaccine, because from VICO in Guatemala, we actually saw that it was protective against endpoint pneumonia. So the more fatal version of pneumonia and bacterial pneumonia. And so this will be a huge help in preventing serious infections, serious illnesses, and hospitalizations. But of course, as well, we want to see people overall living healthier, having better nutrition, kids eating better, and just to reduce all of those rates together. And again, with the high rates of household air pollution, we want to see better ventilation for homes from the higher class, the lower class, the middle class. We want to see that more readily available and easier access for them to have, because they deserve to have to be able to live in their home without having the risk of being sick and getting acute respiratory infections, and in all the risk of possibly being hospitalized or even serious death. And so those are our future directions. We just overall want to see the decreased rates, so it's not the fourth leading cause of death anymore in Guatemala for all ages, but also see people living healthier and being happier inside their homes, outside their homes, in Guatemala, being a healthy country. And then these are our references if you would like to learn more and about the state of Guatemala and just what's going on there. So thank you for your time.